We are actually a county with a lot of infectious diseases. So you find that there is the issue about water insecurity, and that's one of the major issues that we have. You'll find water-related conditions, cholera, dysentery, issues to do with the respiratory diseases, skin conditions, because children don't have enough water to be able to wash themselves. So we have populations that get hurt, get affected, both during the flooding catastrophe and when it is also dry.
We had floods that affected the community and many people were displaced. That is the time where most of our communities were really suffering because of shelter and the outbreak of diseases, that is cholera and the other diarrheal conditions.
The sanitation situation in the communities was overrun. That meant that people had to go into camps and we had to play catch up because they're in camps and the sanitation facilities became a problem. Most of water is surface water. It got overrun. And because of that, we've had 2 to 3 bad outbreaks of cholera.
Approximately over 160 clients were tested and found to be positive for cholera. And we had 3 deaths out of those clients that came to our facility.
With funding from Global Fund, Amref Health Africa joined other stakeholders in the public health emergency response interventions in the county in line with existing structures. The Public Health Emergency Response Programme had 3 main objectives: ensuring continuity of essential healthcare service delivery, particularly to the affected or displaced population and communities in hard-to-reach areas, to control and manage cholera and other diarrheal diseases through WASH interventions, and lastly to enhance preventive campaigns to avert any outbreak through risk communication and community engagement.
We have a lot of problems in this area. Since I came here, we don't even have a hospital around. When pregnant, it's really a difficult time when you're giving birth. Some mothers have even lost their babies. During long rains, we cannot access clean water or medicine for treating water. We drink dirty water.
During that time when we are really struggling to manage cholera cases, we are struggling to get clean water for our communities who are displaced. It is that very time when our partner Amref came in, and he came in the right time because during that period, even the facilities around the community were not functioning because of the strike of the clinical officers. There were no services in the facility around where the community were converged. So when they came, that is the time when we were able to reach the community through outreach, integrated outreaches to the camps, even to the villages where we had most cases of cholera.
That is the point. We needed those IV fluids. We needed antibiotics. Yeah. We needed topical treatments for our children who are having skin issues, and Amref was able to do those supplies for us. And so at the point where we had cholera, and you know the amount of ringas we need, the amount of normal saline we need, dextrose that we needed, at that point we were getting overwhelmed, but Amref was part of the partners that were able to support us to be able to get those supplies.
Amref came, they said that we want to do comprehensive outreach services, an integrated one, whereby immunization services were being carried out, nutritional aspect, that is assessment for children for for malnutrition, were being carried out. And other aspect is the lab services, whereby we are able to test those that need to be tested at the site of the outreach. We also have the pharmacy aspect, whereby we are dispensing drugs which were actually purchased by the Amref. They are also giving us aspect of HTC, that is HIV counseling, whereby people are tested at the site of the intervention. We are also carrying out mental health aspect, whereby those people who are displaced, there are people who actually were being affected, whereby people lost their properties, their animals.
We have seen mothers with kids who have not been immunized simply because they cannot reach the hospital. We have NCD patients that cannot come to the hospital for drugs because it is far. Now that Amref has decided to bring these services here, they are thankful. We have seen women there coming with their babies, others are pregnant. In fact, others have started their NC profile today, which is a good thing to them.
There is what we call one health approach, whereby we go to the community, we're able to offer these services at once. We do two main approaches. We do human health, and also we have added another one called animal health. So whenever we go to outreach in a given community, we are going to do curative. That is part of human health, and also aspect of animal health, where we have a department of veterinary. We go as a team, we talk about health in animals, whereby we talk about the diseases being transmitted from animal to human. And then the veterinary goes on now to issue of treatment, vaccination of animals at the outreach site.
Amref, in close collaboration with the county government, supported water treatment at the point of use in the 811 households through capacity building the communities and issuance of 34,721 water treatment chemical tablets during the all-inclusive integrated outreaches. This was further reinforced through the distribution of 400 pieces of Sawar bags, donated by 4 Life Solutions, an initiative where water is purified through utilizing the UV solar light solution.
Our community health assistant, CHPs, and the public health officers are involved in preventive services, where we are able to visit the nearby school where we are offering those services. We are able to give health talk in schools. We are able to distribute sanitary pads at the school, especially for the young girls. We are able also to distribute soaps at the schools. And at the same time, we are giving health talk at the institution, and especially we are advocating issue of proper hand washing, use of Petra-Trin. And remember, we are using this platform because children are a good agent of change.
In partnership with the county government, Amref accelerated efforts towards risk communication and community engagement through the community health promoters, community health assistants, and public health officers who provided health education on basic sanitation and appropriate hygiene promotion, in addition to demonstration of proper hand washing and issuance of hand washing soap in 2,628 households and 36 schools. The project supported Garson Sub-County utilizing the existing community units to conduct accelerated simultaneous sensitization sessions on cholera to 90 community health promoters in the 9 priority community units in the affected areas.
As a result of these interventions, there is some improvement in terms of the health standards of the community members, especially the ones which were affected by the floods.
We are free from a cholera outbreak as a sub-county, and from those areas that we were able to report those cases due to the intervention of community engagement and especially conducting those dialogue at the community levels. The previous diseases we have been having, like diarrhea, coming to our facilities, now we're able to tackle them and respond immediately at the ground level.
The project was able to conduct 37 integrated outreaches, having a total direct reach of 18,500 people through curative and promotive services. The project also contributed to the flattening of the third wave trend of cholera outbreak and actualization of an all-inclusive multidisciplinary integrated synergized outreach, including curative, promotive and referral services.
I appreciate the aspect that Amref has brought in and the issue about mental health, that our communities are able to withstand these shocks. So we are working towards resilience. How do we come out strongly? How do we protect the vulnerables in our communities? How do we create systems that are able to respond, even the healthcare system that is able to respond? How do we get our health workers to understand how to protect their communities so that we are more in the preventive mode than the curative mode?
We are thankful that the mobile clinic came here. We felt left out as the hospital is too far. As a community, we are happy and we are thankful.